Hey, I'm Rohan Walvekar. I'm a head and neck surgeon at LSU Health Sciences Center in New Orleans. I specialize in head and neck surgery, endocrine surgery, both for adult and pediatric patients, and salivary endoscopy. I'm just glad to be a part of this platform. Now, I was aware of the platform CSurgeries as a video peer-reviewed option for submitting sort of scientific work, or even work that's instructional in many ways. So it was a good forum for this particular subject. My expertise is in head and neck surgery, and subspecialty expertise is in salivary glands, and I do a lot of endoscopic salivary gland work. And one of the challenges that our patients face obviously is, it sounds simple enough, but how do you perform a salivary gland massage, which is an important part of medical management and also a part of your post-operative protocols. You have patients massage their saliva glands. And like most other things, you assume that people know things, but you don't know whether they actually are doing it correctly. And so that was the inspiration for creating the instructional video, because I didn't find any resource within literature or even something simple and easy for patients to look at and basically get some instruction on how to do this. And the CSurgeries platform is a very easy, it doesn't provide a lot of friction for publishing, in terms of the fact that yes, the articles are reviewed and peer reviewed by other colleagues, but at the same time, it was a very quick process. And it was the right place for us to do this, because if you just want to submit a video, there aren't a lot of platforms that accept those kinds of research articles. So that was the inspiration and the reason why I chose CSurgeries. Yeah, I mean, of course, you can only be compliant if you are informed, you can only be a compliant patient if you're informed and you know what is expected and how to do things. And as you know, a visual is a great way to describe a process rather than having people read through an article or an instructional manual. So I think this is audio-visual forums have become the way we kind of interact on a day-to-day basis. Most people are on their phones looking at social media and 30 to 1 minute clips of whatever they want to entertain themselves with. This is also a great way to imbibe knowledge and to get instruction. So I think that makes sense with CSurgeries, is that you have these short video clips that are very scientifically sort of validated and peer reviewed. And at the same time, you can get your instruction as well. The interesting thing was, this was a video that was created by the medical students. This is easy enough forum to use. One of the things, what was nice was the medical students were able to take something which is very simple and were able to create content, using anatomy figures, and also using some video components to tell a story that helped them narrate, and which would be helpful for our patients in a way that was easy to understand for the patients. But what was interesting is the amount of views that we got for this particular video, which was quite a surprise. I think we were one of the most cited videos on CSurgeries, and just goes to tell you that simple day-to-day things that we are doing on an ongoing basis sometimes require a little bit of explanation. We just assume that everything is self-explained, but it was very interesting that this is a very common thing. Like salivary gland massage is think that it would be that meaningful, right? But it was very impactful, and I think on an ongoing basis, even for my patients, when I give them an instructional video, it just puts them at a little bit of an ease, because then they can look at the video and know exactly what I'm talking about. So on many levels, for medical students and allied health professionals, looking at content like this is very helpful for them to be able to put whatever they've learned in their classes and put sort of a practical spin on it. Many things that we do in surgery are like, my surgeons are like kind of the greatest sort of innovators, and many of the innovations happen while doing surgery. You find particular unique problems with unique patients with unique pathology, and you have to find a workaround. And sometimes that workaround is reproducible. Sometimes it is relevant for other surgeons to be able to see, oh, if I face this problem, how was this? These are very incidental problems. There isn't a pattern to it. And so sometimes it's difficult to put it in the form of a traditional, in the framework of a traditional research study. Like, you have one or two cases, but those one or two cases can be very important for someone. And so that's why I think CSurgeries is a great forum, because you can share your experiences, even if they are, one or two experiences, but they have worked and they've helped somebody, then it's likely that those experiences might help a patient in the future. So I think it's kind of interesting to be able to have a forum like this, to be where we can share these ideas and share some of these successes.